Good evening, everyone. Welcome. We'll just give a couple to other people to join, maybe 2 to 3 minutes, and then we begin this. Hello, Rita. Can you hear me now? Good evening. Type in the comment section so we can see your messages and know if you can hear and see us clearly. All right. So we give is section. So I encourage you to copy that message that you know to this webinar so everyone can join in and everyone can benefit from all the knowledge that will be shared. Also, remember that we should mention in today's webinar, so I'm sure you don't want to miss. Hello, Joshua Grace. Good evening. It's so good to see. All right, just 1 or 2 more minutes before we begin. All right, so once again, sharing the links for everyone to join on Facebook, on YouTube, on Twitter. Message out. Make sure you're telling everybody that needs to be here. Right, we're going to be having an amazing session today. We have Dr. Maka in the house. We have registered dietitian Tito. If you were here the last time, then I'm sure you know it's going to be answered. Some of you came here wondering what it means to reverse that is even possible. Well, so we're starting really, really soon. All right. So let's keep sending out the messages and we can all get them and we Facebook, YouTube is more convenient for you. So whichever you or your friends you're here, you're sending them okay. Start. So I want everybody to in the comment section say hello, hello to you. Welcome, Art. There is two other people. Sure that people wherever YouTube or technologies from technology universal due to that is doing a lot of things concerning webinar abilities, and you wouldn't be hearing from them call doctor. You'd also be rest assured that you have information that you need. It's possible to use. Once again, this is this webinar. So just put copy that link or share it to someone with here to actually know people need to gain the knowledge that is being shared to give is brought to you. Right? This webinar is basically conditions and living to what a Meditrina is here to do for manage and on WhatsApp, right? A message by saying what did, what are we giving right there? You get free. So every time that you go your contacts and then you be convenient enough to leave your give you access to that. Also give blood sugar readings. If your blood sugar and your professional, a pharmacy will see you of these readings as an easy way so you don't lose it so that you submit your readings on people can train better if you don't have even consider free you would be serious or blood sugar test blood sugar or as every single of the benefits of you later this evening. I'll go on details what Meditrina basis. Another amazing someone that managing then you can also see have a smartphone one a parent a them to make sure that they are keeping, help them sure they're living a healthy life. I just want to encourage people that need amazing, right? Even lots of things you thought you knew about the philosophy, lots of things you thought you knew about them, professionals, all right? By to a doctor, and she's going to be giving you all the information is and everyone is right. So wherever you are, I welcome her. Good evening, Doc.
Yes, good evening. Can you hear me?
How
Can you hear me? Can you hear me? Okay, you can hear me. Okay. Good evening, everyone. I am Dr. Amaka, and today we'll be talking about diabetes for our diabetes reversal webinar. So, what is diabetes? I'm sure we all know that, but diabetes is a chronic disease that is characterized by persistent elevation of glucose or sugar in the blood that can lead to complications in the heart, brain, and other organs of the body. So why glucose? What is glucose needed for? Glucose is the major fuel the body uses to utilize its function. Now, this glucose now is being managed by a hormone called insulin that is produced in the pancreas. So let's talk about the prevalence now. While talking about it, let's look at the types. We have the type 1 and the type 2 diabetes. Now, the type 1 diabetes is globally like 10% of the population have it. Is formerly known as juvenile diabetes. Is caused by, let's say, viruses or other environmental factors that can cause the beta cells of the pancreas not to produce insulin at all. So for the type 1 diabetes, insulin is not produced. Now for the type 2, 90% of the population have it, is more common. So here, insulin is produced, quite all right, but there is a form of insulin resistance. Now, once there is resistance, that means that glucose is going to pull in the blood, because the major function of insulin is to push it out into the cell so that this glucose can be used to form energy through the ATP and other mechanisms. But the main point is that it is used to form energy. Once it's pushed out, glucose is used to form energy. Now, there are so many symptoms, but let's concentrate more on the polyphagia, which is excessive eating, polydipsia, excess thirst, polyuria. Now, this individual is going to be urinating more than 3 liters or thereabout of urine in 24 hours. Then weight loss. There are other symptoms of diabetes. So what is the impact? Why are we talking about diabetes? Diabetes is a chronic illness. It's an illness that is managed every day. Now, for the people that have tipped into the complications of it, you see some people living without a limb, a leg, or people that are blind, people that have a chronic kidney disease, or that have suffered a stroke. Now, these are part of the impacts that diabetes causes and why we need to look at it. Now, diabetes can cause sudden loss of life through the diabetic emergencies like the ketoacidosis and the hyperosmolar hyperglycemic state. Now, someone can just come into the hospital and die within 2 hours. Now, diabetes is something that can drain money. for people that have CKD, dialysis, the kidney transplant and all, it drains finances. Now, for people that have the information and they want to manage it now, learning about this diabetes can help us to know about our numbers. And when you know about your numbers, you can manage it through the dietary control or when you're taking your drugs. So these are some of the reasons why we need to learn about diabetes. So let's just quickly talk about the complications of this diabetes. Now, before we talk about it, let's look at the metabolic syndrome that can cause the type 2 diabetes, which is obesity. Also, there is decreased high density lipoprotein. There is high triglycerides. Also, high blood pressure is part of the syndrome that can cause type 2 diabetes. Also, another thing that makes up this thing that can also cause this type 2 diabetes is family history, positive family history of diabetes. Now, if one of your family relation have suffered it, there is a tendency that it's going to happen. Then lifestyle, like smoking, yes, is a contributing factor to diabetes. So now let's look at the complication. So diabetes cannot just come now to affect the brain or the heart or other systems. It's the lifestyle, bad lifestyle, lack of quality control is going to cause all these complications that can lead to loss of life or can drain finances. So another thing we need to know is the atherosclerosis, that these atherosclerosis like fatty plaques that come to deposit on the blood vessels. Now, when this deposit there, it with time, with the build up, that is why we need to manage this diabetes with Wellahealth Meditrina. We need to manage it with our professional dietitian, because this atherosclerotic deposition is something that occurs over time. It takes time, like over 4, 5 to 10 years, for it to now deposit to that point where the complications will be seen. Now, this thing happens on the arteries and also the hyaline membrane, where the exchange of gases takes place. Now, after this occlusion must have occurred, these organs now, these major organs now, we no longer get the blood supply that is needed for it to carry out its function. So things are going to occur. An example is in the heart now. The major blood supply to the heart is the coronary blood vessel. Now, when the space now is being blocked by plaques, by fatty plaques, the heart is no longer going to get enough blood supply it needs to carry out its function. So with time, there is going to coronary disease, coronary vessel disease is going to occur. And now this person can have myocardial infarction and the rest of it. Now, when it occurs in the brain, stroke can happen. When it occurs in the eye, the retina, through blurring and other pathways, this individual can be blind. Like when I was in school, okay, during my internship, we had a patient that came in. She was blind already, but during history taking, we found out that the first time she heard about that she has diabetes was when she noticed that her sight is blurred, that she has blurry vision. She went to the hospital and tests were carried out, and she found out that her blood sugar was high. And then through management and poor management, she later became blind. So that is a sign of complication of diabetes. So another thing is this, if it happens in the blood supply to the legs, to the extremities, the peripheral vascular disease, this person can suffer from claudication. And whenever these individuals have a wound, there will be poor wound healing. Now, this poor wound healing will throw a cascade of reaction that might lead to amputation, because normally once there is high concentration of glucose in the blood, it causes poor wound healing. With other poor management, it can lead to amputation. So that's why you see majority of diabetic patients, they have one or two of their limbs amputated. And that is why we need good management, and Wellahealth Meditrina is here for us. So here also we have as part of the complication, we have it in the kidney. Now the kidney, there are some parts, the glomeruli of the kidney, we undergo cellular death. Now when this part of the kidney dies, now those good substances that the kidney usually reabsorb is not going to reabsorb it again. It's now going to be lost in the urine, and that will now cause the chronic kidney disease. Now it can also occur in the eye. Also there is cataract when sorbitol accumulates due to the hyperglycemia. Also we have erectile dysfunction. Now the nerve, this hyperglycemia will cause a form of demyelination. The Schwann cells that are in the nerve will start dying. And when it starts dying, it will affect the nerve cell, the nerve that supplies the reproductive organ. So this person will start experiencing erectile problems and libido challenges. Also in the stomach, the lining of the stomach, and there will be gastroparesis. Now, what about the sensory loss that happens? The person will no longer feel their self. There will be paresthesia. Now, there are other complications that diabetes bring about, and that is why we need early intervention. Early intervention is very, very important to curtail this complication, because if you have diabetes or you have a close relation that have diabetes and is not being managed well, now this person will have maybe the blood sugar will be 200 today, the next day it will be 450, another day it will be 150. Now these irregularities will still cause all these complications to be happening on a low key. Now when with time we are not going to see the full-blown aspect of it, so it's very good that we manage it. And part of this diabetes reversal is through lifestyle change. The lifestyle change, you need a health team, you need a doctor, and you need a professional dietitian. And that is what Wellahealth Meditrina is offering us. Is a health program where you have access to a doctor, you have access to a dietitian. Now this dietitian is going to work with you on the food aspect, because yes, the doctor is going to give you drugs. There are drugs for cholesterol, there are drugs to reduce sugar, but to reverse diabetes completely, and I have seen people that have reversed their diabetes completely. To reverse diabetes completely, you need a professional dietitian. Now this dietitian is going to educate you on what you need to do, because now these atherosclerosis I mentioned being deposited by these cholesterol plaques, there are some kind of diets you need to take and it will be reduced. This dietitian will tell you about the polyunsaturated fats, which are the good fats that can lead to the increase of high density lipoprotein, the good fats. The major source of it is from taking nuts, from taking fish, and vegetable oils like olive oil, canola, sunflower. Now, when you see this oil, they are healthy. They are healthy, but you won't go and pour 1 cup of oil when you are frying egg. You are not doing good to yourself. Now, the dietitian is going to direct you that, okay, why frying egg? This is so that you can be able to reverse your diabetes. Now, the dietitian exercises that you need to do, if it is working that you want to do, or you want to go to the register in a gym, the dietitian is going to put you through it. So we also help you to manage your sugar by recording it through charts. Yes, you record maybe if you're checking it through the glucometer, if you're checking it maybe 3 times a week or even daily, we are going to help you to monitor it, because At the end of the day, that is what you need for a complete, for a wholesome care. You need your doctor and you need your dietitian. So if you have, maybe you are not the one that is diabetic, you have your mother or a relation that have diabetics, and you register her with us. Now we are going to walk her through with drugs and good information, because information is power. And then the dietitian is going to take over with the type of diet your relation loves, or you yourself, the type you love. And then with the portion control and everything, we are going to walk you through this reversal thing. It's not something that happens. It's not magic. You need discipline too. You need discipline to stop eating everything she have listed you to stop eating, because the bad fats, you get the bad fat from dairy, from like milk, cheese, red meats, and simple carbohydrate like Coke, donuts, bread, white bread, and all those things. Yes, these are the things that will lead to bad fat. As you consume it, you are helping these fatty deposits to be occurring on your heart, the retina, and all the other part of the body. So now you need to work with us, so that we can walk you through it. We will give you more information that you need, and then we will help you with early intervention. Early intervention is key. Now you can't be coming in here, maybe you already have a end stage kidney disease, and you've already been booked for a transplant. No, no, no. Now the reason why we're doing this program is for you to have information that the time to register for this program is now. Now that, let's say that all those complications have not settled, or that you already seen those the effects of the complication, and you need the team, the doctor and the professional dietitian, to move in immediately so that it can be reversed. So early intervention is key. Knowing your numbers is key. And also working with the doctor, because sometimes, like when I was a medical student, the man I used for my final examination, a 55-year-old man that knew that he had diabetes. Yes, he knew quite all right. But he went to a church program and he was declared free. But I am a faith person. I believe so much in God. But then I would follow it through with maybe 3 monthly routine check. But he didn't do any of these things. So he suffered a wound. That was 5 years later. He suffered a wound now. No, within 3 days or later. He went back to the first of all, they would start the people to the hospital will be the last place. It's now too late. Now when this very high degree of that was amputated. So is information, but work with today. Let's start today. Let's start today with so good, because it's affordable. It's affordable. Because the price of this program with us every day. One beautiful thing about this program is once we get to that stage that your diabetes your sugar control is being monitored at a very good level, you can start removing the drugs that you take. Now, instead of maybe you take metformin. So if you take metformin every day, let's say you take 1 gram daily, this program is going to help you reduce it to 500 grams. And from there, you can start taking it 3 weekly. So early intervention is key. So early intervention is key. So thank you so much for coming to this program today and listening to my voice. We can't wait to have you on our program. Thank you.
That was really amazing and that eye-opening. If you actually learned something from everything that Doc, I just want you to put a comment in from any platform you comment section that you think, or if you have a question, just question. All right. So Amaka has been really helpful in letting us how we can actually affect these ways and to see that a lot of people have until a much later time. So I'm going to give some time now to register to Tito to come on everything related to how to actually do everything that you're there to know. Hi Tito, can
Hi, Lois. I can hear you.
you
Can you
good
hear me?
evening? Welcome,
Good evening.
welcome.
Can you hear me? So I think that I have a little bit.
Hear you now.
Okay, yes, I think I have a little network issue. We live in Nigeria, so everybody will bear with me. I will try and make this as easy as possible. Good evening, everyone, and it's a pleasure to be here. My name is Tito Ike. I'm a clinical I was saying that my name is Tito Ike. I'm a clinical dietitian, and I am the lead dietitian at the Meditrina Diabetes Reversal Clinic. And what we are set to do, or what we are focused on doing, is to help individuals like yourself, your loved ones, or anybody, friends and family managing diabetes, to help them reverse diabetes, sorry, my network is so I hope it gets better soon. So like I was saying, what we're doing is that we are set to help Africans, friends, family, to reverse their diabetes, leveraging diet therapy. And so what that means is, we have a lot of people that are tired of we have a lot of people that I'm sorry, I don't know what to do about this internet. It just started this evening. We have a lot of people that are struggling with they don't want to use drugs, they're struggling with their drugs. There's something called medication fatigue, they're just they're tired. And they think, sorry, please, my network is again. And they're saying to themselves, something has to kill a man with an assault diabetes. I'm here to offer you hope. And that's what we do at Meditrina Clinic. So we just 12,000 naira. This program runs for 12 weeks. It's a program that is focused on using the regular Nigerian food. So so I'm sorry, I don't know what to do. So usually what happens is that when we talk about diabetes diet, a lot of people think that we're going to give them meal plans that um, uh, people
Okay, can everyone loud and put it in the in this webinar, but yeah, through. But if you can hear me there, I want you to put it. Tito would try to get her mic up again, and but let me know if you can hear me. Just put it in the chat. We'll see that, and then on anything you want to say this evening, everything that just to emphasize like diabetes or how you can reverse diabetes if it is actually possible. All right, so from Facebook, from YouTube, hear us. Let us know you can hear. Hi Tito. Good to go. Oh, says I'm still breaking. How about it better? Just let me know if it's better. Okay, so someone says the audio for your call. Okay, dietitian Tito comes up. I'm ready to inform us. To be worth of for hypertrainer. So I need you to stick to the end. We'll be putting this person to answer correctly right, to be on who win this 5,000 medication if ID curious. Is it better now? Is clearer. I don't think we can hear you. I'm sorry.
Can you hear me?
Hear us now. Loud.
Okay, I apologize for the terrible network. Again, we live in Nigeria, so we have our bad days. Please, I hope everybody can hear me now. I apologize for. I mean, these things are not planned. All right, so I was talking about the Meditrina Clinic and what we do and how we're doing it differently. The Meditrina Clinic, Diabetes Reversal Clinic, is a nutrition support clinic where we use diets to help you reverse your diabetes. I have some patients that come and they say things like, oh, we stopped using our drugs because we wanted to join this program. No, we don't do any of that. What we do, like Dr. Maka has said, is that we work closely with your doctor, we work closely with your primary physician to ensure that we are able to push back this diabetes back into remission, back into reversal. And so how we achieve this is by using your regular foods, your regular Nigerian foods. Some of the things that people say is that, oh, I stopped eating rice, I stopped eating bread, I stopped eating eba, I stopped eating amala. And what we say at Meditrina Clinic is you can eat absolutely all the foods you love to eat and enjoy, but what we would do is teach you how to eat it the right way, how to combine it the right way, the right food timing, when is right, when is not right. what are you supposed to do when you have blood sugar spikes? Now, the problem is that when it comes to diabetes management, a lot of people do one size fits all. But what they do not understand is that what works for Mr. A does not work for Mr. B, and definitely will not work for Mr. C. And so what I see a lot of times, especially on the internet and social media and friends and family, so somebody comes and says, oh, I have diabetes. All of a sudden, there's a lot of unsolicited advice. Oh, don't eat this. Oh, eat this. Oh, forget that because it works for you doesn't mean it's going to work for somebody else. Just the way, I don't know if you remember chloroquine. I know that when I was small, I had malaria, my mom would give me chloroquine and I would eat all night, right? Meanwhile, you have some people that had no reactions to chloroquine. And you also had some people that when they take chloroquine, it would just give them dark spots. Same things with, sulfonamide drugs. Some people react badly and some people don't. And it's the same thing with your diet, especially when you're managing diabetes. And so it is not a one size fits all. I know that a lot of times when we say we want to talk about diabetes, people just say, okay, what is your general advice? I want to say to you that because diet is, in this case, we are using your diet as medicine. Let food be your medicine. And in a situation where we're trying to use food as medicine, it means that it has to be personalized. Number one, we have to put into consideration the foods you want to eat. Number two, we have to think about, foods that are available in your local market. Number three, we have to think about how you react to all of these foods, right? How you react to it. And so this is not just a kind of situation. And that is why it's important that you come to Meditrina Clinic. Now, the cost of this clinic is 12,000 naira, and it's a 12 weeks program. So 12 weeks program is 3 months. 12 weeks is 3 months. And in those 3 months, myself and the dietitians that work at Meditrina Clinic, we will be your best friends. And I say that to every patient that works into our doors. For 3 months, you are our best friends, or we are your best friends. And why I say this is because we follow up on you every day. That's not what you're going to get in your hospital. Your doctor will say, come back in the next 3 months. But the period between when you first walk into the hospital and in the 3 months, what happens during that time? What happens? A lot of times I hear patients say, but I've not been eating, but I've been doing everything that I'm supposed to be doing right. But I don't know why. My blood sugar is just high. And the doctors, especially, doctors will just say, oh, you're not compliant with your diet, and that's it. But what we do differently is for every patients, we follow up on them daily. And why we do this is to ensure that this medication that we are giving you with food, these foods that we are using as drugs to help you reverse your diabetes, it is effective. And so like I said, when you come in day one into the clinic and we admit you into our clinic, we give you a meal plan, we give you portion control guide, we talk to you extensively. I particularly would ask you, what are the foods you love to eat? Is there any food you do not want to eat? Because also we have to know that what usually happens is people just say, don't eat this, and a lot of times you are left with nothing to eat. Yeah, just eat unripe plantain and beans. How long are you going to do that for? And so what our aim is to say, what are the foods you want to eat? What are the foods you love to eat? And how can we help you suit it into this plan that not only are you enjoying your meals, we are also going to help you reverse your diabetes. And that is why you should sign up, to the Meditrina Clinic. This program is just 12,000 naira. We have clinics in Lagos, we have clinics in Abuja, and we have a clinic in Uyo. But not to worry, if you're not in any of these locations, you also have access to a virtual clinic. And of course, I am the dietitian that runs the virtual clinic. So it means that you get to see my face more often, you get to speak to me more often. And trust me, you want me to be your dietitian, because aside being a clinic, I think my network is okay. Aside being a clinical dietitian, I am also a chef. So it means that I understand the medicine of food in all its complexity. And as a chef, I also understand the simplicity of food. And so when we have conversations around diet, I'm able to help you simplify it in such a way that you understand and you know exactly what you're working with. So I apologize if you have tried any diet in the past and it has not worked. It's because you've not worked with us at Meditrina Clinic. Again, this program is just 12,000 naira. And with 12,000 naira, if you're currently on drugs, you know how much you spend every other month trying to buy your medication. And we are saying, come, with 12,000 naira, we're going to work with you to ensure that, number one, we drastically reduce your medication. Number two, we work closely with your doctor so that they are able to understand exactly, what we are doing and work with you, also on the hospital side. And number three, we are going to help you reverse your diabetes. Now, don't expect us to do abracadabra. So people come into the clinic and they want to hear that just drink this portion and in 2 days your diabetes is reversed. No, no, no. You also have to do the work. We would work with you. You also have to do the work. And that's why it's a 12-month journey. It is a journey to good health, a journey to long life. Some people have had diabetes for 3 years, some people 6 months, some people, some people are even newly diagnosed. So we are saying to you that in 12 weeks, we're going to work with you hand in hand to ensure that, you do not have any complications. Because the truth is, as simple as diabetes is easy to manage, because it's easy to manage. People just don't understand how to manipulate their diet and how to work around it. But the truth is, as simple as it is easy to manage, like Dr. Amaka said, people are losing their lives. People are losing their lives. People are spending so much money, on hospital drugs. And we are here to offer you a permanent solution for just 12,000 naira. So please work with us, right? This program is just taking only 100 people. It's just a program that's lasting, over a short duration of time. It's going around up very soon. And we did a webinar 2 weeks ago where we had, lots of people sign up. And so we are here again saying that you have to sign up today, not tomorrow, not next tomorrow, because once we have, exhausted our slot of 100 people, that's it. Now, 12,000 naira is not, we understand that the economy is somehow, but I mean, when you think about how much you spend on food, how much you spend on drugs, and how much you spend on going for doctor's visits continuously, and we are offering you a permanent solution with just 12,000 naira. You and I know that is what, is what the money is, what the time is, what the resources. So work with us. I would, for those of us that are in Lagos, and for those of us that would see a dietitian virtually, so it doesn't matter whether you're in Ibadan or Abeokuta or Kano or other, once you pay, you join the virtual class. I will be your dietitian, and like I said, I understand all of the complexity of food as it relates to medicine and as it relates to culinary art. So let me be your dietitian. Let's work together and let's help you reverse your diabetes. Thank you very much. Over to you, Lois.
Thank you so much, Vito. Can you
What
can
did
you
you
hear me
say?
clearly?
Yes, I can.
Thank you so much for attention as much as possible. I think that network isn't so amazing. I hope that, but nonetheless, paid attention to every single thing that 1,000 naira for 12 weeks. And she said 12,000 is still for you to have, you're going to be getting the dietitians all throughout 12 is an amazing clinic. All right. So what you want to do is you want to look. It has been posted to the message to the number. Send a message link that is in the message there. All right. It has been pinned on Facebook, YouTube. You chat that message, that number up on to answer. Just going to have questions, and then we give you access to pay for the clinic. All right. Remember, this is yourself personalized. So not even like this webinar where it's not just people join to be a one-on-one session. All right. So every concern question you have to ask, you remember that having or managing something you can do about it. That is something like join the 12 weeks that so to do only or in 12 naira, send your WhatsApp the comments simply click to WhatsApp direct you to initiate available. All right. Then don't say that you're sign up today to make sure you are able to steal a slot for yourself if you are in or if you are in South and send him a long as you can this number on WhatsApp and you can send that you know that maybe managing diabetes now that they can first set that they them say or based on spending you have our Dr. Amaka is a professor we go with you throughout the clinic or on where you're joining from. So that depending on you're getting proper advice and no one is coming up to tell you and then someone my friend said just remember it's a personalized experience for the next 12 weeks. 12,000 only message to the number. If you can't see it in the comment section, and it's to you. Medication vouchers. So if you are interested in a worth of a medication, I'm going to be sending a call and then I'll give right an answer. You can just put whatever. So whoever on YouTube, that person is going to be on medication. So what you can do with that of our partner pharmacies, any lecture for diabetes. All right, that is what's for you. So guys that you need to join in quickly. Ask them to be sending the question now. First thing, I'll ask that for now. Just read and send the question. Facebook, you are on X. Remember the fastest answer. For your answers. To see the chat, whoever answers correct first is 5,000 naira worth vouchers. Remember that if you should, by the way, John 12 all that message. I'll pin the question to number that is going. It is 12 that they are limited on this. It means limited slots. One time. Just check on the screen, save it on your phone, save and begin. You can do this from now. In your message now. Seeing an answer from right Swift. You joining us from X Okay, book wherever you're joining from, just attempt an answer there, and you stand a chance to win 5,000 naira worth of medication vouchers. All right, so I believe we have a few. I believe we have a few responses now, so we can start collating our answers. Anywhere that you are, remember you can give it a shot. YouTube, Facebook, and Twitter or X. All right, so I'll be dropping the next question now in case you missed the first one. So the first question is over. If you're just seeing it, unfortunately, we've had some answers and we're going to be reviewing them very soon. So the next question is coming up. The next question is coming up. Same thing, fastest fingers first to win 5,000 naira worth of medication vouchers. So wherever you are, check Instagram, check Facebook, check YouTube to make sure that you can be a part of this. So fastest fingers first. Once again, it is on your screen the number that you need to register for the 12-week reversal program. 12-week diabetes reversal program. If you forget anything, do not forget this number. All right, it's on your screen now. I want you to take it down. I want you to click the link from the comment section. All right, comment section, and use that to initiate the chat on WhatsApp. Remember, it's available wherever you are. So, fastest fingers first, Facebook, X, Twitter. Love to see your responses. 5,000 naira up for grabs. Okay, so for the first question, on YouTube, Tony Steven, right? You got the first question correctly. So I want you to send a WhatsApp message to the number I am typing now. So please send a WhatsApp message. Send a WhatsApp message to this number. Okay. Remember, the number to join the 12-week diabetes reversal program is still on your screen, still in the chat section. 09082 All right. It is pinned on Facebook, Instagram, wherever you are. Okay. Joel Osaji from Facebook, thank you so much for answering. Joel Osaji. All right. If you're on Twitter, if you're on Facebook, wherever you are, you can partake of this. Okay. So I believe we have our winners for tonight. Thank you so much to Tony Steven joining us from YouTube, who got the first question correctly on YouTube. Thank you to Joel Osaji, who got the second question on Facebook. Right, so I'm sending to send us your details on WhatsApp. Um, okay, for the second question, YouTube, Oluwatoyin Odesumi. I hope I'm pronouncing that correctly. Also send a message to this WhatsApp number. that I'm putting on the screen. So make sure you do that within the next 5 to 10 minutes, all right, so that you'll be able to claim your 5,000 naira medication voucher. Okay. All right. Thank you all so much for joining in tonight. If you were a winner from our 5,000 medication voucher giveaway, please make sure that you get the phone number from the chat section of wherever you're joining from, or you can send us a DM on any of our social media platforms. So for Facebook, for Twitter, and for Instagram, we are at Meditrina or at Chat Meditrina, which I'll also be dropping in the in the comment section for you to follow up. 12,000 naira for 12 weeks to reverse your diabetes. Send a message to us today. You're going to get a personalized experience to make sure that you are handling this condition in the best way possible, with the best possible care from experts anywhere that you are in Nigeria and even outside the country. All right. So make sure that you're sending this around to your friends, your family. Send them the WhatsApp number. Tell them everything that you learned, even if they were not able to join today. Remember, we have limited slots. All right, just for 100 people, and too many people have been signing up, and we want you to be a part of this. So make sure you send a WhatsApp message to that number and begin your journey today. All right, forgive me, on YouTube, the first person to answer the second question correctly is Osiro Erie. Pardon me for that. So our YouTube winners once again, Tony Steven and Osiro Erie. And then our Facebook winner is Joel Osaji. Joel Osaji. So make sure you are sending a message to the numbers that we have put in wherever you are within minutes. Thank you so much, everyone. Thank you, Doc. Thank you, registered dietitian Tito, for your wonderful insights tonight. Really appreciate you for being here and for giving us all of this wonderful, wonderful information. All right. So I hope that you have a wonderful evening. Once again, my winners, please make sure that you are sending a WhatsApp message to the number that is in the chat section. All right. Within the next 5 to 10 minutes. All right. Wonderful night rest. Thank you all so much for joining.